So, in regard to kids going back to school, it's not going well. And there are some schools that have opened, and some schools are using masks, some are using masks, which is optional, and then some are not using masks at all. They're fighting against the mask. They have parents fighting against and protesting that they don't want their kids to wear masks. Well, this is what it has caused. So the new school year is already a disaster. Thousands of students are quarantining as COVID cases are skyrocketing among kids. And then I also have another article that talks about kindergartners no show putting their futures at risk. And a lot of this has to do with what's going on out there. The Delta virus is now the main cause of a lot of worry. And so this is by Aria Bendix. And so I noticed that I already knew that this was going to happen for the mere reason that I have seen it. I've actually seen this. I've seen it with my own eyes. I've seen where schools were set to open and they had to close down for 14 days, shut the whole school down. So days into the school year, COVID-19 outbreaks have already forced thousands of students to quarantine. So experts predict that the pediatric infections will continue to rise, leading to more school closures. And so bans on masks while young kids wait on vaccine authorizations make it tough to protect the students. And so mere days into the school year, thousands of kids across the U.S. are already being asked to quarantine following exposure to COVID-19. So in Mississippi, there were daily cases that have doubled into the last 2 weeks. More than 4,400 students were quarantined from August the 2nd to August the 6th. This is according to the state's data. So one Mississippi school named Pearl River Central High School has quarantined nearly 40% of its student body since August the 5th. And so the entire school district opted to go virtual for at least 2 weeks to be safe. The Mississippi Free Press has reported it. And in Reno, Nevada, more than 80 students were likely exposed to the COVID-19 on Monday. So this was after a parent knowingly sent their infected child to school. And so I think this fall is going to be really challenging for schools. And this was said by Richard Besser, former acting director of the Center for the Disease and Control and Prevention, told NBC Today's show on Tuesday. So I think children belong in the classroom, but what we're going to see is little outbreaks, clusters in different schools shutting down and then reopening again. So Besser said he expected schools to shut down more often this year than they did last year. So already pediatric infections are on the rise. And so the U.S. recorded nearly 94,000 children with COVID-19 cases between July the 30th to August the 5th. So more than doubled the number of the pediatric cases recorded during the 2 weeks period or prior. So pediatric hospitalizations have risen 27% on average in the last week, as shown in the chart. So this is the U.S. and from 0 to 17 years of age. And then you see how the line is going up, meaning that's the sharp rise of kids that are contracting the virus. And my theory is that when they were at home and they weren't as around with large groups of children in classrooms, you didn't really see or hear as many cases. They were happening, but it wasn't as pronounced as it is and prevalent now as it is. But now that kids are starting to gather, they're in lines, they're going to the bathroom together, they're in rooms together, they're sitting close, and even if they're sitting 6 feet, even if they're sitting 7 feet apart, they're inside of classrooms. A lot of the schools have changed for the protocols regarding the disease, but even with that in place, as clean as people say that they are, if someone is sick and they come to school sick, other kids are going to get it. And so that is what makes this more complicated and complex. So scientists agree that the Delta variant has made school outbreaks more likely than not. And so the variant is 2 to 3 times as contagious as the original version that started it out of the virus, according to one estimate. And so the vaccinated people can still spread the Delta to other people as well. Maybe you're not going to get as sick, or maybe you get a little sick, but you still can spread it to those who aren't vaccinated and to other people that you come in contact with. So the Delta variant has created a new and pressing risk to children and adolescents across the country, as it has also done for the unvaccinated adults. So this is coming from Dr. Lee Savio Beers, president of the American Academy of Pediatrics, who wrote in a recent letter in the Food and Drug Administration. So the letter called upon the FDA to ensure that COVID-19 vaccines for children can be authorized as swiftly as possible. So bans on mandates make it difficult to control this transmission. So this is in Texas and Florida, where they are requiring that the kids either it be optional or they don't wear a mask, because they think in Texas and Florida, some of these states who are trying to take away the mask, the parents have put pressure on them and it hasn't been working. So that's why there's a higher rate of transmission in those schools. So studies of school transmission last fall indicated that masks and social distancing lowered the spread of the disease COVID-19. But that science hasn't changed, but Delta leaves even less room for error. So masking and distancing still work even for the Delta. So it's just that you have to be more meticulous. So this is Hillary Babcock, the medical director of infection prevention at Barnes Jewish Hospital and St. Louis Children's Hospital in Missouri. So she recently told the Insider this. So both Texas Governor Greg Abbott and Florida Governor Ron DeSantis recently, they banned their mask mandates in the schools. And so DeSantis even threatened on Monday to withhold the funding for schools that required the mask. And so Florida and Texas are seeing more daily rates of pediatric hospitalizations than any other school in the U.S. on average. And so Texas recorded 54 pediatric hospitalizations per day between August the 1st to August the 9th. And most recent data available, Florida, meanwhile, recorded 40 pediatric hospitalizations per day over the same period. And so the national average was just 5 daily pediatric hospitalizations per state during that time. And so several Florida and Texas counties are pushing back on their state's anti-mask policies, though. And it's because they see the sharp rise in children that are ending up in the hospitals. So in Texas, officials in Dallas and Bexar counties recently won court orders challenging Abbott's school mask ban. And some Florida counties, including Palm Beach, continue to require face coverings instead of inside of the school buildings and on the school transportation, contrary to DeSantis' rule, because they want to protect the kids, because they see the data reports and they see the complaints coming in of parents that realize now it was a huge mistake to take away the mask and to to act as if this variant is not out there, and it has act like the kids can't get it. And now you see that the kids are gathering in these classrooms. There's groups of kids together in larger numbers, and they're riding the bus. I don't care how much you say they're going to be apart. They're going to gather, and because they're in situations where they gather. They're, at schools, there's lines to go to the bathroom, a line to go to lunch. People are sitting together to eat. People are on the yard. People are in the classrooms. There's lots of groups of folks. And in the hallways, when they're switching classes, that is the perfect environment for this virus to spread. And so I'm saying that because I know I've seen it. And I've seen schools, and I'm not just saying this because of an article either. I've seen schools where as soon as they open, they are now closed because one or two kids have come to the school infected, and they've exposed many kids with it, and that school has to close. They have to act on those protocols immediately. And so as of Wednesday afternoon, however, nearly 500 students in Palm Beach were quarantined. That's how many kids could end up going home after being exposed to COVID-19 just 2 days into the school year. And up to 6,400 Palm Beach students didn't wear masks during the first few days of class despite the mandate, the local CBS 12 station reported. So some Texas schools have found it similarly difficult to enforce mask requirements. And so you can't ask people to wear masks, you can't require people to stay home, and you can't require people to get tested. But I felt safer last year coming back to school than I do this year. Becca Harkle Road, that's her name, Becca Harkle Road, a school nurse in the central of Texas. And so she told the 19th, she told the 19th on Thursday. Okay, and so one glimmer of hope is that the vaccine may soon be available for kids that are ages 5 to 11, and Pfizer expects to have data about vaccine efficacy among the age groups by the end of September. So that's coming soon. So that would put the U.S. on track to start administering vaccines to children that sometime in October. That could happen very soon. So assuming that the FDA authorizes those. And so that's for that article. And this is how some of the schools have set up their lunch areas. But even with that, you're in places where there's lots of gathering going on. And so the other article is saying that thousands of kindergartners are no-shows, putting their futures at risk, experts say. And I bet this is because kids that are under the age of 12 right as of now are not permitted to get vaccines. And so there are also some children who are not able to wear masks because they're not able to keep them on, and they're really young and they don't understand. And so Barnini Chakraborty is the one who wrote this article. So hundreds and thousands of kindergartners across the country expected to enroll in traditional schools or attend online classes are now no-shows. So the coronavirus pandemic and the economic fallout and the 2 years of inconsistent guidance from the CDC and prevention, the Center for Disease Control and Prevention, have worried parents to the point that they have chosen to forego traditional schools altogether. But new data from the federal government seem to show that the decline or the decisions to keep children at home might have done more harm than good in the long run. And so I've seen kids that are running around with no mask. They're outside playing all day during hours that they probably should be in schools. So in all, more than 1 million children have been expected to enroll in online learning or attend traditional school failed to show up over the past 18 months since the pandemic hit the U.S. So the missing students were concentrated in younger grades, with steepest drop coming from kindergartners. And so, according to the data, which analyzed enrollment at 70,000 public schools, more than 340,000 kindergartners were no-shows. That's a lot of kids. So, all right. So many educators have been skeptical about the virtues of remote learning for such young students and say it's important that they get in-person instruction. So kindergartner is also generally where children are first diagnosed with developmental disabilities such as autism and spectrum disorder. Okay, missing out could mean even more setbacks academically and socially. So they're not socializing with other kids and they're not learning concepts. They're not learning how to engage in life skills or skills that can carry them out through life. So a separate analysis by the New York Times University, which is a Stanford University, showed that 10,000 local public schools, 33 states, lost 20% of the kindergartners. And in 2018 to 2019, only 4,000 schools saw similar drops. And so largest declines came from neighborhoods just above or just below the poverty line. So where the average income for a family of four is less than $35,000 a year, in those communities the drop was 28% larger than the rest of the country. And so, like I told you, I've seen kids, they're running around, they're playing, they're not really engaging in any reading material, they're not really doing anything that's academic of any sort. And if they are doing anything, it's not being monitored. There's a lot of distractions around the home. There's a lot of poverty going on too, because there's people that are dealing with eviction. There's the parents they're dealing with not having jobs, and then they feel like they don't have anything else to support themselves, so they just kind of remain wherever they are, struggling, or maybe they're using this time to find on and in work just to keep afloat until they're able to feel more comfortable going back to their workplace. But I'm hearing a lot of people are still out of work and not finding it safe or easy to just go back into the workplace. There's different situations. And so the largest declines are coming from places of poverty. So in one Philadelphia school district where the majority of students came from low income households and neighborhoods, kindergarten enrollment dropped for more than a quarter between 2019 to 2020, the fall of 2020, according to the analysis. So the decline was 3 times the national rate, according to 2,700 missing 5 and 6 years olds. And so that's a lot of kids. And like I told you, even around here in South LA, I've seen a lot of kids don't look like they're really attending schools. And so there was a huge drop reported in Jackson and Mississippi, which saw about 24% decrease in kindergartners. So in Connecticut, kindergarten enrollment fell by 4,343 students, 36,566 in October of 2019, and 32,223 in October 2020, nearly 12% decline in a single year. So similar to other state findings, the decline in kindergartners was disproportionately greater among the states with the lowest performing districts as well. So schools that are lower performing, or they have not as good turnout when it comes to maybe testing, finding out where kids' levels are. The lowest performing schools, they had a larger number of children that were not in attendance. And so the news didn't get much better for the children who did show up. And so elementary school students ended 2020-2021 school year about 4 to 5 months behind where they normally would have been in academic achievement. And so, according to this report by consulting firm McKinsey and Company, and so that was based on an assessment taken by more than 1.6 million elementary school students who had returned to the classroom in spring. So students that were mostly Black or Hispanic ended the year with 6 months behind in math, and this was compared to white children who were only about 4 months behind, the survey has found. And so in Virginia, less than about half the kindergartners statewide met the benchmarks of school readiness, and so the children lost academic and social skills between entering school last fall and finishing this past spring, according to the data from Virginia Kindergarten Readiness Program. So what we're seeing is a very alarming situation. Rich Schultz, president of Smart Beginnings Greater Richmond, told Henrico citizens. Okay, so, but unfortunately, it's what we expected to see, and we knew that kids were going to fall even more behind. So today, there is still uncertainty and confusion about cohesiveness of school reopenings, the plan among parents, teachers, school officials, which some say could signal more setbacks for students. And so that's pretty much how this article went. And it's really sad because we see a generation of kids who are going to miss out on academic learning because of the virus and because of the indecisiveness with the schools and the parents and the confusions that are going on and the fighting back and forth on whether kids should wear a mask, whether they shouldn't wear a mask. And then also you have this large number of kids that are now becoming infected, which we weren't seeing as much of that in the beginning when this whole thing started out because of all the closures. That basically tells you that when the kids weren't gathered together in these settings, these school settings, then you've seen less outbreaks, or you've heard of less incidences of kids getting in. It was so rare that you had people thinking kids couldn't get it. You know, kids can't get it. They can't get sick, because they're smaller, they're younger. But now we're seeing that is not the case. And if they're in the perfect environment and they're around other people who have already been exposed and they're already sick, then you'll have larger numbers of children that will become infected. And some children may be able to go through the infection a little different than others, and others may end up in the ICU. And so would you really want to gamble and risk that? And so that might be one of the reasons why you see a lot of the younger kids that are not in attendance. And I would think that would be one of the main reasons, is that parents are afraid. They've seen these reports. Some of them have paid close attention and asked questions about how many kids are going to be affected at the school. Is it safe to go back into the schools with all of this stuff going on? And so some of those parents have opted out of traditional school altogether, or they just resorted to, I've seen it where some parents would, even though in-person learning has gone back into effect in some places, some parents are still ready to just stay online. They'll help their kids do online learning because they don't want the risk of their kids getting infected and then having to feel guilty that they sent their kids back to school and their kid got sick and could have possibly died. And so that's what I've been hearing from parents. That's what I've been seeing. Even the staff, teachers are scared. They feel like their lives are put at risk. They could bring sickness home to their families, or they could die. And so a lot of things are happening that, maybe we've seen some of it on the news, but I don't think it's being talked about as much. Not enough to raise the alarms to enough people to look at it and say, wait a minute, the children are being affected. You have these adults, they're fighting on whether their freedoms are being denied. But this is a matter of life and death. And so you're not here to enjoy any freedoms if you're dead. And so when you're dead, you won't have any freedom because you're dead. And so that's what this whole issue has been about. And so if you are sick, if you have people that are sick or that they could be sick, we're doing things to try to see how to protect people so that they won't become sick or they won't end up dying from these diseases. And so that's what this boils down to. So you have some people that are using different excuses because of fear or because of maybe things that they've been told over the internet or they're a part of different cultures or religions or groups or beliefs. And so they feel like taking vaccine is going to make them sick, or it's going to infect them, or they're being targeted. They're a targeted group, and they have dealt with racism. And so there's a lot of things that are going on. And so that's what makes this so complicated. And I don't see this going away anytime soon. Looks like it's going to be with us for a long time. But in the meantime, as adults, as parents, you have to make the best decisions for your kids. And I know a lot of really great parents don't want to see their kids come down with these illnesses and end up in the hospital. And to be a parent in a time like this and then feel that guilty feeling that if I just had have waited, or if I know that's what's in the heads of some people. If I just had have let them stay home and do the online learning or do virtual learning, something else, homeschooling, then maybe they would be here, but no, I wanted to push them back into a school, and I don't know who's there who could be sick. And so that's what some parents are thinking. That's probably why you see a sharp drop of enrollment. And now we even have the college level students. I'm sure even though they're young adults or young people that are becoming adults, parents still worry. The worry's still there. Is my son or daughter going to come home? Or are they going to be sick? And so you wonder. And then some students, they feel like they don't have to worry. They feel like because they're youth, they are invincible, and they opt out of getting vaccinated. And some will even pay to forge vaccination cards. That's been going on. But I believe what's coming down the line is fines and then maybe even jail time, because you're putting a lot of lives at risk, not only just yourself, but other people who, maybe if you're walking around and you're asymptomatic and you're sick and you don't feel symptoms right off, other people can get it and they may not be asymptomatic. They could get sick and they could die. And then they're also passing it along to other people. More and more people get infected. And so that is what is happening. It's just really chaotic. So I believe that reason why kindergartners, a lot of them aren't coming, is because right now they haven't approved for kindergartners, that age group under the age of 12, to get vaccinated. So they're left sort of out. So just imagine you're being a parent, you get vaccinated, but you can't get your kids vaccinated because they're not old enough yet. And you're worried, and so you don't feel comfortable with them going to school around other kids who aren't vaccinated, who you don't know who they've been around. And so everybody's suspicion antennas are up, and the fear antennas are up, and so they don't know whether it's safe or not. And so I believe that's what's happening with the school ager kids that are in like maybe K to 12. It's, some kids, they want the in-person learning, they want the socialization, but they may have to risk getting sick if they get exposed. Because like in the article I read where one parent, she knew her kid was infected, she sent the kid to school anyway. I saw that happen. I saw a school where the parent was infected and the kid was exposed, and they sent the kid to school infected. Half the day went by and all the parents were called, and they came to the school to pick their kids up immediately. You should have seen the directors of the school, how enraged and how worried and scared they were, and how many staff had to run around cleaning up the school because of that one parent's decision to come infected, knowing they had the virus. That is not a pretty decision at all. And then having other parents angry and having to explain to them that they now need to get tested and get their kids tested. And some people don't see that side of it because they're only thinking about them. selves, and they're thinking about what freedoms are being taken away from them. When they're taking lives by coming to places knowing they're sick and infected. People could die. So anyway, I've seen it. And so that's the reason why I did this one, because I have seen it. And if I didn't see it, I wouldn't be saying this. But I've seen this happen. So anyway, and I've seen how kids have to come every morning and get their temperature checked, the staff included. And then you have to now to go to school, because this infection is so bad and spreading. Now everybody, even the staff, has to be tested. Even if you're vaccinated, you have to be tested every week. So I'm going to let this go. I'm not surprised about any of this. And so I just think some people are very selfish. They're ego-centered, and they're not really understanding the ramifications and the consequences of this disease.